scopolamine patch is ordered. What type of drug is it? What is it used for? How long will it last if it's given in a patch form? I need you to know the difference, a definition for the hypothalamus, the pituitary gland, the cerebral cortex, and the medulla. The definition for homeostasis. Look up the drug Leuprolide, Leuprolide. What is it used for? And what adverse side effect does Leuprolide normally give? Somatropin given to 11-year-old. What outcome would indicate that the drug should be stopped? When shouldn't you give this drug, somatropin, to an 11-year-old? A patient receiving a glucocorticoid. What nursing diagnosis would be of highest priority for a patient who's on a glucocorticoid?
Can you spell that word?
Gluco, G-L-U-C-O. Corticoid, C-O-R-T-I-C-O-I-D. Glucocorticoid.
Nursing assessment, diagnosis.
Nursing diagnosis. What would be a priority nursing diagnosis for a drug like this? Look up the adverse effects and figure out what would be a great nursing diagnosis. Know what thyroid stimulating hormone is? An anticoagulant for AFib. Know the name or a few of the names for that anticoagulant. And what is a priority nursing assessment? What do we have to monitor for when somebody's on an anticoagulant? You have a patient who reports type 1 diabetic who gets hypoglycemic late in the morning. What could cause hypoglycemia in the morning, late in the morning? You've had this question already. I need you to write down all the reactions, the signs and symptoms of hypoglycemia. the drug pramlintide, pramlintide. What's the priority nursing intervention to include? You have this question too. Look up how it's given. PO, sub-Q, IV, that's a clue. Look up how it's given. What is a hemoglobin A1C? What is jaundice? Look up methyl testosterone. What assessment finding would warrant a call to the doctor? An older male client taking androgens has difficulty swallowing medications. What drug would the nurse identify as being a good choice for this client? Needs to be on androgen therapy, so what type of drug would you put him on, or anticipate a doctor putting him on? Cardiac, let's see, know the structures of the heart? Or chambers, what's in the middle chamber? Not middle chamber. Well, yeah, I guess I couldn't say that. What's between the chambers?
Ventricles, valves.
Valves, what's between the right side and the left side? Septum. Know the flow of blood. Almost done. Electrical conduction of the heart. Where does it start? Where does it end? Somebody who has left-sided heart failure. What signs and symptoms are you going to see with left-sided versus right-sided? What would be the first-line medication that somebody would be put on for hypertension? Mild hypertension. This isn't somebody coming in with a blood pressure of 200 over 120. Mild hypertension. What drug can you anticipate? What does creatinine clearance mean? What does creatinine clearance mean? How does it relate to drugs? Diltiazem, what is it used for? And what is the most common adverse effects from diltiazem? A patient taking an ACE inhibitor. What does ACE stand for? And remember what I say, volume equals, write that down. Angiotensin II receptor blocker, or ARB. Who should not take this? What patient is this contraindicated in? And it's not allergic to the medication, okay? What does pulmonary edema look like? What are the signs and symptoms of pulmonary edema? Isosorbide. Come on, we can do this. Come on, isosorbide. And hydralazine are used for hypertension. What should be a priority nursing assessment based on the adverse effects of these two drugs together? What's a priority nursing assessment for a patient who is on digoxin therapy? You know, what body system does dig affect the most? What labs do you need to look at before giving digoxin because of toxicity? What is the antidote for digoxin? When giving an antiarrhythmic agent, what's a priority nursing assessment with an antiarrhythmic? What do you assess for? Nitroglycerin and diltiazem together. What would be a priority assessment? These two drugs given together. Diltiazem. Select all that apply here.
What is a priority assessment?
Yeah. Next one's a select all that applies. It's about atorvastatin. What does it do? What's the use of atorvastatin? What does it do? Does a few things, not just one thing. Atorvastatin, what foods should not be taken with atorvastatin? What foods or drinks are contraindicated? need to know the antidotes for heparin, warfarin, digoxin, opiates, benzodiazepines. A patient is being considered for anticoagulants. What aspect of the client's history would not indicate use? So if you know what anticoagulants do, what patient should not get anticoagulants? Iron, let's see here, something about iron. Ferrous gluconate, which is iron, has been ordered. What is it used for? What food interactions occur with iron?
What was the actual word?
What food interactions with iron? Ferrous gluconate. What is pernicious anemia? Pernicious anemia? How does it relate to taking vitamin B12? Pernicious anemia, how does it relate to vitamin B12? Patients being discharged at home on a diuretic, what patient teaching needs to be done at home if they're on diuretics? We've had this question before. When somebody is taking a loop diuretic, such as furosemide, what labs should you monitor for? Client has had a cough for 2 weeks. What should the nurse tell the patient to do? A patient is on codeine for a cough. What are the adverse effects of codeine? You have a patient who's on an inhaled sympathomimetic. What type of drug is an inhaled sympathomimetic? Who is it used for? And if it's an inhaled medication, how soon should you give it before exercising?
What kind of drug is it?
Inhaled sympathomimetic. Know how to administer an inhaler. Go back over your steps on how to administer an inhaler. Why would a patient who has lung cancer be on dexamethasone and aprepitant, A-P-R-E-P-I-T-A-N-T, one of the drugs we went over today?
What's the first one?
Dexamethasone. Why would a cancer patient be on dexamethasone and aprepitant?
Together?
Yes. Why would they be on these drugs together? All right, I need you to look up a drug called clomiphene or Clomid. Clomid, C-L-O-M-I-D. Basically, what does Clomid do? What's the mode of action for Clomid? Why would you discontinue laxative therapy? What signs or symptoms would make you discontinue laxative therapy? Know what you're giving it for. Why would you stop giving it? Couple more people. All right. What does tetracyclines do to children's teeth? What type of teaching would you give to somebody who's having GERD that doesn't respond to medication? When taking non-steroidal anti-inflammatories, why should a patient check their stools frequently? Patient on non-steroidal anti-inflammatories, why should they check their stools frequently? Why should somebody on an immune suppressant be on protective isolation? And what is protective isolation? What type of medication would somebody who has asthma be on? What's the category of medication? A fast-acting inhaler. What's the name of that fast-acting inhaler?
Can you say it one more time, please?
What is that fast-acting inhaler for patients who have asthma? Sulfonylureas. How do they work to normalize glucose levels? Sulfonylureas. S-U-L-F-O-N-Y-L-U-R-E-A-S. Sulfonylureas. How do they normalize blood glucose levels? How do they work? You have a patient who has diabetes, prescribed glucocorticoids. What issue will they have? Diabetic, type 1, prescribed glucocorticoids. What issues are they gonna have?
Can you spell that?
Glucocorticoids, yes, you heard that already, look on your notes. Pulmonary edema. Patient being treated with furosemide. What do you need to monitor carefully? What is extravasation and what do you need to do about it? Antipsychotic drugs. What are some of the adverse effects with antipsychotic drugs? You have a patient who's receiving opioids. What would be a priority assessment? What is prostatic hypertrophy? How does it relate to anticholinergics?
Hypertrophy?
Prostatic hypertrophy, BPH.
Can you say it one more time? Just the question.
BPH, how does it relate to anticholinergics? What would you expect to see if you give somebody albuterol? What would be a common reaction? When giving digoxin, what is a nursing priority before giving digoxin? What assessment do you need to do on the patient before you give digoxin? Your insulin, Glargine, Glargine. How long will it last? Before you give an antiarrhythmic, you need to assess the patient for what? An antiarrhythmic, you need to assess the patient for what? Know your different antibiotics. Penicillins, aminoglycosides, sulfonamides, fluoroquinolones. Which ones are caustic to the kidneys? Which can cause tendon ruptures? Which ones can cause an allergic reaction? And what type of allergic reaction? What are the signs and symptoms of an allergic reaction? Whew, we done. Shake out your hands.
Antibiotics cause
You can get into groups, help each other with these. You are here till 2. If you need to do a skills check-off, today is the day, it's Friday. You must check